Monkeypox outbreak in Europe. Over 40 suspected cases of monkeypox have been detected in England, Spain, and Portugal, and one case in the USA. But health officials in Europe haven't traced the source of the virus yet. This is rare and unusual. UK Health Security Agency is rapidly investigating the source of these infections because the evidence suggests that there may be transmission of the monkeypox virus in the community spread by close contact. The disease, which is most common in Central and West Africa, typically kills up to a tenth of the people infected, with most deaths occurring in younger age groups according to WHO. So what exactly is monkeypox? Monkeypox is a sylvatic zoonosis and a rare disease that transmits from animals and belongs to the Orthopoxis genus according to the World Health Organization. This particular species also include smallpox, vaccinia virus, which is used in smallpox vaccine, and cowpox virus. Monkeypox virus is very similar to the virus that used to cause smallpox. The virus was first discovered in 1958 when two outbreaks of a pox-like disease occurred in colonies of monkeys kept for research. The first human case of monkeypox was recorded in 1970 in the Democratic Republic of Congo, where efforts were being made to eliminate smallpox. It's not unusual to have outbreaks this way, since generally the transmission is through rodents such as squirrels, rats, etc. The generally known way of transmission is through close contact with wild animals from the African region. There were outbreaks in the USA in 2003 where they localized the causes of the outbreak to be prairie dog. There are two clades of groups of monkeypox virus: the West African clade and Congo basic. According to WHO, while the West African type could lead to several illness in some individuals, the case fatality ratio is reported to be only around 1%, whereas the Congo basin group's fatality ratio could be as high as 10%. So children are at higher risk of catching the virus, and if it infects women during pregnancy, it may lead to complications, congenital monkeypox, or stillbirth. Now let's see what are the symptoms of monkeypox. Monkeypox can be transmitted by droplet exposure through its said large droplets and by contact with infected skin lesions. Symptoms are usually similar but milder than smallpox, and the lesions can be very itchy or painful. Fever, headache, muscle ache, and exhaustion are classic symptoms, while monkeypox causes lymph nodes to swell. Smallpox does not, according to CDC. The incubation period of monkeypox is usually from 1 to 2 weeks, but can range from 5 to 21 days as well. The illness generally lasts for 2 to 4 weeks. In Africa, monkeypox has been shown to cause death in as many as 1 in 10 persons who contract the disease. Monkeypox does not entirely come from monkeys. Monkeys are only incidental hosts. They are not reservoir hosts. Reservoir hosts harbor the virus without manifesting any symptoms. So if the rodent bites a human or a monkey, that particular monkey becomes an incidental host. So monkey can transmit the virus if they are infected with it. So is sexual transmission possible? Health officials have reported that the virus could be spreading by sexual contact. However, this is not yet confirmed. What is even more bizarre is finding cases that appear to have acquired the infection by sexual contact. This is a novel route of transmission that will have implications for outbreak response and control. Further, Dr. Hopkins advised gay and bisexual men to be alert and notice any unusual rashes or lesions on any part of their body, especially their genitalia, and to contact a sexual health service if they have concerns. The evolving theory is that it might be sexually transmitted. However, we do not have enough data to confirm it. If you look at the previous cases from early 2000s and in 2018, the majority of the patients have a history of travel from Nigeria, but it is difficult to say why it is spreading at a fast rate. So how it can be treated? Well, the world has seldom heard of this rare disease. It has been significantly increasing in DRC, in Central Africa. The number of cases increased tenfold between 2010 and 2019. In 2020, there were nearly 4,600 suspected cases in the country. Currently, there is no approved treatment for this disease and is generally controlled by smallpox vaccines and antivirals. The CDC recommends a smallpox vaccination within 2 weeks of exposure, ideally within 4 days, for exposed healthcare workers and household contacts of confirmed cases. Most patients recover simultaneously. It is a viral illness that goes away by itself. However, clinical studies have shown that cytophobia can be used to control an outbreak. Data is not available on the effectiveness of cytophobia and brincidofovir in treating human cases of monkeypox. However, both have proven activity against pox viruses in vitro and animal studies.